There's a neurological disorder affecting more than 300,000 people in the U.S. It's called dystonia, and while the symptoms can be similar to Parkinson's disease, it's often difficult to diagnose and to treat. To learn more about it, I'm joined once again by Dr. Donnica Moore, Editor-in-Chief of Women's Health for Life. Dr. Moore, great to see you again.
Thank you. Likewise.
So first, tell us a little bit about dystonia. I think there are probably a lot of people out there who've never even heard of this disease.
Yeah, and that's one of the reasons we're talking about it. Basically, dystonia is what we call a movement disorder. It's the third most common movement disorder after essential tremor and Parkinson's disease, which most people have heard of. And what it is a constellation of symptoms resulting from any damage to the basal ganglia cells of the brain, which interrupt the signals that the brain sends to the rest of the body, particularly to the muscles.
Right.
So in general, what these people get are severe muscular contractions, twisting movements, distortions, and spasms that are involuntary. They can't control this.
Is it very painful?
Sometimes it's painful. This is a gradual, progressive disease. So there are people who can have a very mild, localized, or what we call focal dystonia, which affects only one muscle. So a common form that most people aren't even aware of as dystonia is a severe form of writer's cramp, where after a while of writing a few sentences, then they'll get severe cramps and distortions of the muscles of the hand. But more people have more serious types. Cervical dystonia is the most common form of focal dystonia, affecting one group of muscles, and that causes twitching and involuntary contractions and spasms of the neck muscles.
Oh, that sounds, if not incredibly painful, very uncomfortable.
And very disabling.
And very disabling. And so how does this differ from Parkinson's disease?
Yeah, great question. They're in the same category of disorder. Essential tremor, the first most common movement disorder, is characterized by just tremors of the hands, the arms, and occasionally the head. Similarly, dystonia is characterized just by muscular contractions and spasms, either of one muscle, a group of muscles, adjacent muscles, or one half of the body. Parkinson's disease, on the other hand, is a very complex syndrome where they may have tremors. They may also have a dystonia-like set of muscle contractions and spasms, but they also have a disordered gait, so their walking is that characteristic shuffling gait. Their movements are generally slower. They have cognitive impairment and memory loss. It's important to note that people with dystonia do not have any decline in their intelligence, and Parkinson's patients also have personality changes.
Can dystonia lead to Parkinson's? Can it be the first step?
In general, if it's true dystonia, it doesn't become Parkinson's.
Right.
There are some people who think that happened to them or their relative, but they may have been misdiagnosed in the first place. However, there are some patients who are well documented to have dystonia and Parkinson's disease. The other complication is that there are many medicines to treat dystonia and Parkinson's. There's no cure, but many of the medicines also come with a whole host of side effects that can really cloud the clinical picture.
So treatment of dystonia is still rather tricky.
It is. There are a whole host of medicines that we use to treat the different symptoms. Of course, as with anything, we want to use the lowest possible dose because of the side effects, and the side effects can cause other complications. But in addition, patients can build up tolerance to the medications, and then they don't work as well. Another good treatment option, though, for many people are Botox injections directly into the muscular contractions. And again, here we want to use as low dose as possible and dose it, once every few months so that the patient doesn't build up a tolerance to it.
And so how do people get dystonia? Is it something that they're genetically predisposed to get, or do they develop it somehow?
Great question. There's about 15 to 20% of patients who do have a genetic mutation in a gene that's called DYT. We used to just talk about DYT1. Now there's almost 15 that are identified. But the other patients we don't really know. Some causes where we've been able to identify are brain trauma, so brain injury, even trauma during birth. And some babies who have this are misdiagnosed as having cerebral palsy, for example. But drugs and radiation therapy, so if somebody had a previous cancer, particularly of the head or neck area, that's a risk factor. Poisoning, like mercury, lead poisoning, or other kinds of poisoning. And then, of course, the basic category is unknown.
Now, why is it that we know so little about this disease? We hear so little about it, yet it affects a fair number of people.
Well, I have a theory about that. I mean, the first thing is there's no celebrity who's been talking about this. The second thing is there's not a huge lobby group that's out there trying to get research. The American Dystonia Society is recently formed. There's many other advocacy groups. But these patients, for the most part, become disabled and homebound. So we don't see them. And one unfortunate force of our culture is if somebody's out of sight, they're out of mind. So one of the most disconcerting symptoms and difficult symptoms of this condition for patients to deal with is loneliness. They can't drive. They only have a few hours a day that they may have good function, and they become totally dependent and totally disabled and totally isolated.
And so what advice do you have for people that either have a loved one that may be suffering for this or worry that they're suffering from it themselves?
Well, first of all, I think support groups can be extremely helpful. Obviously, these patients can't usually go to a support group, but the American Dystonia Society is having online and virtual chat meetings and things, which can be very helpful. The second thing is really to find other people who have this condition. Again, online is a great way to do that. The third way is talk about it with your friends and family. Educate them and let them know that you need company, that you need a ride, or whatever it is. Because people do like to help, they just don't know how.
Dr. Donnica Moore, thank you so much for all this great information. And for more information about dystonia, you can go to dystoniasociety.org or dystonia-foundation.org. And of course, you can always visit us on the health page at abcnews.com.